Hello, I'm Dr. Brennan from LongIslandAfterCare.com. Being admitted to the hospital can feel confusing, especially when you are tired, worried, or waiting for information. In this video, I will explain what usually happens from the time you arrive in the emergency room until you are assigned a hospital bed, who may be involved in your care, why your diagnosis may change, and why the exact timing of visits and discharge can be difficult to predict. Every hospital works a little differently, but this will give you a general idea of what to expect. When you arrive in the emergency room, a triage nurse will assess how urgently you need care. Patients are not always seen in the order they arrive because someone with a life-threatening condition may need immediate treatment. You will usually be evaluated by an emergency room doctor, physician resident, physician assistant, or nurse practitioner. They may order blood tests, an EKG, x-rays, a CT scan, an ultrasound, or other testing. The emergency team's first responsibility is to identify and stabilize urgent medical problems. After reviewing your symptoms, examination, test results, and response to treatment, the emergency room team may decide that you need to remain in the hospital. The emergency provider will then contact an admitting physician or hospitalist. A hospitalist is a doctor who specializes in caring for patients while they are in the hospital. Many hospitals have hospitalists who work specifically as admitting physicians. Their job is to evaluate newly admitted patients, review the available information, enter initial orders, begin treatment, and determine whether the patient should be placed under observation or admitted as an inpatient. Observation and inpatient are different hospital classifications. The decision is based on your medical condition, the severity of your illness, the treatment you're expected to need, and how long your hospital care is reasonably expected to continue. Your status may also be reviewed and changed as more information becomes available. You may officially be admitted or placed under observation, even though you are still physically waiting in the emergency room. Once a decision is made for you to remain in the hospital, the bed placement team looks for the most appropriate available room. Bed assignment is not simply based on who has been waiting the longest. The hospital must consider whether you need a regular medical or surgical bed, heart monitoring, intensive care, isolation, specialized nursing care, or a bed on a particular hospital unit. Sometimes patients remain in the emergency room for several hours or occasionally longer while waiting for the correct bed. Even while you're waiting, your medications, monitoring, testing, and treatment should continue. Many different healthcare professionals may participate in your care, including nurses, pharmacists, therapists, case managers, social workers, and specialists such as cardiologists, pulmonologists, neurologists, surgeons, or infectious disease doctors. On most hospitalist-led medical services, I describe the hospitalist as the captain of the ship. This does not mean the hospitalist works alone or ignores the recommendations of other healthcare professionals. Every member of the care team contributes important information. A cardiologist may make recommendations about your heart. A pulmonologist may advise on your lungs. A physical therapist may determine whether you can walk safely. A case manager may arrange rehabilitation, home care, oxygen, equipment, or transportation. The hospitalist listens to the entire care team, reviews the overall clinical picture, and brings the different parts of the treatment plan together. A specialist may say that you are cleared from that specialist's point of view, but that does not always mean you are ready to leave the hospital. Other medical issues, test results, treatments, or discharge arrangements may still need to be addressed. On a hospitalist-led medical service, the final medical decision and discharge order generally come from the hospitalist. Listen to every member of your care team, but when you want the final answer about the overall plan or whether you are medically ready for discharge, speak with your hospitalist. Many daytime hospitalists work approximately 7 in the morning until 7 in the evening, although schedules vary by hospital. Some hospitalists remain physically in the hospital throughout the entire shift. Others may cover several areas, complete rounds, and later be available by phone or through the hospital system. You should generally be able to request communication with your hospitalist before the daytime shift ends. Tell your nurse that you have questions and would like to speak with the hospitalist. The hospitalist who admits you may only be your doctor for the remainder of that shift. Overnight hospitalists are available to address urgent problems and changes in your condition. The next morning, another hospitalist may take over your care. The outgoing and incoming doctors communicate through a medical handoff. Important information about your diagnosis, treatment plan, pending tests, and consultations should be passed to the next physician to maintain continuity of care. It is also important to understand that diagnoses can change after admission. When you first arrive in the emergency room, the doctors must make an initial assessment based on the information available at that moment. For example, pneumonia or a urinary tract infection may initially be considered because of symptoms, blood work, urine testing, or the first interpretation of imaging. These are often working or provisional diagnoses. They are not always the final conclusion. As more information becomes available, the picture may become clearer. A chest X-ray that initially appears concerning for pneumonia may later look more consistent with fluid buildup from heart failure. Similarly, bacteria or abnormal findings in the urine do not always mean that someone has a true urinary tract infection. Many older adults have bacteria in the urine without an active infection. If there are no urinary symptoms, no fever, no convincing inflammatory findings, and the urine culture does not support infection, antibiotics may not be necessary. This does not mean that anyone ignored the problem or made a careless diagnosis. It means the original diagnosis was provisional, and the treatment plan is being updated as additional evidence becomes available. Different doctors may also interpret findings differently. The hospitalist reviews the entire clinical picture and adjusts the plan when needed. A helpful question to ask is, what is the current working diagnosis, and has it changed since admission? Another common question patients and families ask is, what time will the cardiologist be here? Unfortunately, the nurse or hospitalist often cannot provide an exact time. Specialists may be seeing patients throughout the hospital, performing procedures, responding to emergencies, working in an office, or covering more than one hospital. Urgent consultations are generally prioritized. Less urgent consultations may occur later in the day or, depending on the circumstances, the following day. Your nurse can usually confirm that the consultation was requested but may not know exactly when the specialist will arrive. Discharge planning also begins on the day you arrive, including while you are still in the emergency room. This does not mean the hospital is trying to rush you out. It means the care team is beginning early to identify what you may need for a safe discharge, such as medication changes, home care, rehabilitation, medical equipment, oxygen, transportation, follow-up appointments, or help from family members. You may see a tentative or expected discharge date in your chart or on the communication board in your room. Tentative means estimated, not final. The date may change based on your symptoms, test results, specialist recommendations, mobility, oxygen needs, medication changes, or whether necessary services and equipment can be arranged. Your discharge date may also depend on where you are going after the hospital. A short-term rehabilitation facility, nursing home, assisted living facility, or other care setting may require insurance authorization, clinical review, an available bed, transportation, or acceptance by the receiving facility. Some facilities do not admit new patients on weekends or holidays, which can also delay discharge. For this reason, you may be medically ready to leave the hospital but still need to wait until the next level of care is approved and available. Ask your hospitalist, what still needs to happen before I can safely leave the hospital? Hospital care involves many teams working together, and some parts of the process are difficult to predict. Your healthcare team may not know the exact time a bed will become available, when a specialist will arrive, or precisely when you will be discharged. However, you should always feel comfortable asking who is coordinating your care, what the current working diagnosis is, what tests or consultations are still pending, and what needs to happen before discharge. Keep a written list of your questions. Designate one family spokesperson when possible, and ask for clarification whenever something is unclear. This video is for general education and does not replace advice from your own healthcare team. I'm Dr. Brennan from LongIslandAfterCare.com. helping patients and families better understand the journey through hospitalization and aftercare. LI Aftercare is dedicated to helping patients and families better understand the hospital journey, from the emergency room to admission, observation status, discharge planning, medications, rehab options, and what to expect after leaving the hospital. Our goal is to make healthcare less confusing, less overwhelming, and easier to navigate with clear, practical patient education. Visit liaftercare.com for resources patients and families need throughout their healthcare journey, including amazing, detailed maps of rehabs, assisted living facilities, physicians, specialists, home care services, and more. Please follow LI Aftercare on all social media platforms for more helpful videos, patient safety tips, and hospital guidance. Follow us on Facebook, TikTok, Instagram, X, and YouTube at LI Aftercare. Long Island Aftercare, helping patients and families feel more informed, prepared, and supported.